There was endometriosis that I didn't even know about, right? There was other issues, underlying issues that we weren't even aware of. I woke up right after surgery. She said, you literally screamed like, I feel like all the blood and all the oxygen that I wasn't getting before, I can get again.
You didn't have a simple case. It was a really difficult case. So if you could give one piece of advice to someone in your shoes who is struggling with a decision about a hysterectomy, what would that be? Welcome back to the Dr. Rich channel. We have a special treat today. A special guest, Brenda Lee has come to talk about her surgical journey with hysterectomy. It's a topic that somehow in 2025 remains taboo, and I felt this is a great opportunity to bring her on, share her story. Welcome.
Thank you. Thank you. I'm happy to be here.
Thank you, first of all, for trusting me to care for you. And I just want the audience to get to know you a little bit. Tell no stranger to social media, but tell us a little bit about yourself.
Well, my name's Brenda Lee, and I'm originally from El Paso, but I've lived in New York for the last 18 years, and I recently relocated to El Paso, thankfully, because I was able to see Dr. Rich. And, you know, obviously I've had issues with fibroids and endometriosis that I didn't even know about until we had surgery. But that was why I decided to do the hysterectomy with Dr. Rich, the robotic laparoscopic surgery.
What do you do for a living?
I work for Estee Lauder. I'm an associate for the North America sales team.
Okay.
So, yeah, go blue.
All right, well, let's get into this. So let's start at the beginning. Mm-hmm. So you had a need to undergo a surgery, mm-hmm. and you can talk about that. How was it that you first found me? What search criteria did you have to find somebody?
So the underlying issue for obviously the treatment was fibroids, and I didn't even know I had fibroids my entire life. And as I found out, women find these on accident, right? Like we don't even know we have them until they're significantly large and they become an issue.
Yeah.
So I found out I had fibroids, and then I went to I moved back to El Paso, and I went to one gynecologist, and I didn't really like his approach at delivering the fact that I was going to have to do a hysterectomy. He was kind of really like abrupt about it, and no other options. That's all you have. That's all you're going to do. And that's it. And I was like, okay, we're going to go see another doctor. So I went and saw another gynecologist, and she told me she was going to do her research. She said she could, she also recommended a hysterectomy. Mm-hmm. She was going to, she recommended if I wanted to do laparoscopic, it would have to be a urogynecologist that does it, right?
Interesting.
Right?
Okay, yeah.
And then I said, okay, well, do you know of one here in El Paso? Because I was still back new to the city. And she's like, let me do some research and I'll get back to you. She never got back to me. I think I told you this. So I went and did my own research. Yeah. And of course, you were the top one.
Yeah.
Because there's like the top best in all of North America, and you're one of them. So I was like, oh my God, I can't believe he's in El Paso. Like, what are the odds? And me being spoiled from New York, I assumed like he's going to be in New York. He's not going to be here. And I was really happy to find out that you were here.
Here I am.
And then I made the appointment right away with your admin team when I called, and they were phenomenal and got me in. And I honestly thought it was going to be a lot more hoops. I thought I was going to need a referral. I thought it was going to need like all these things. And they're like, no, you're good. Like, we'll see you next Monday. And I was like, oh, okay, cool. And I came in and I met with your nurse practitioner first. And I told her, you know, this is a scary word everyone keeps throwing around at me, hysterectomy. I need to know, is this my only option, considering what my issue is?
Well, let's talk about that. So, and you came to find this out, but most of the time, you know, as you said, patients still come in and say, hey, doctor, I have a 12 centimeter intramural, fibroid type 8, and it's pressing on my bladder, causing, you don't know. No. You come in, you have symptoms. You have heavy bleeding, you have cramping, you have pain. And through the process of a workup with ultrasound, exam, you had a really big uterus. It was 1,000 grams. I mean, normal's 80, so like 12 times the normal size.
I was an overachiever.
You were. One percenter.
Yes, 1%er. That's, it's how I roll.
That's how you are.
That's how I roll. Even when it comes to like having really bad situations, I guess I'm the 1%er. But that's why I loved your team, because when I came in and I was like, this is the issue, is this really my only option? Or is there other options? And they took the time to explain everything as to, this is why we do recommend the hysterectomy, but these are the other options, which you're not really a candidate for. But if you really want to go that route, like,
Yeah, it's your body.
It's your body.
Yeah.
But just know you'll be back here.
And I'm sure there's comfort in that,
Yes.
that you know, there may not, the other options may not be as good. They may not give you as much relief as long. But yeah, people like choice.
Right, right. And my choice was I wasn't going to have children anyways. So I was okay with the hysterectomy, but I still needed to know that just for my own peace of like, I like having options.
Yes.
Do you know what I mean? Like,
Absolutely.
Even if I was like, okay, I'm not going to have children, but I still liked having the option. So I think when I met with you at that final time before making the decision, you definitely put that like, okay, I need to do it, right? Then it was just a problem of scheduling it, right, around work and when was I going to be able to be
when's the best time?
When's the best time?
Well, tell me about that, because I think a lot of people feel that hysterectomy means you're going to be in bed for 2 months, you're not going to be able to go to work for 3 months, which historically I think that was very accurate. People would get like a C-section or an up and down incision, and you know, everybody needs time to recover from that major change, that major incision. And I've often on this channel talked about the patient experience. And when you combine minimally invasive robotic surgery, you combine the expertise of, you know, top 1% surgeon who's done the repetitions, who's done it over and over, knows the ins and outs, and the process of having, we call it ERAS, but an enhanced recovery protocol, a multimodal pain protocol, where you're treating pain with different medications at different times at different levels, anti-inflammatories, nerve medicine, nausea medicine, and occasionally narcotics for when that's necessary. We've talked about on this channel how, in my experience with my patients, when they come back to see me in 2 weeks, 95% of them are on no meds, they're back to go to work, and they're ready to go back to work. And I've gotten a lot of comments on some of these videos where they're like, you know, stop lying to patients, you know, you're misleading. And I don't know, I felt it was a great opportunity to bring you on to talk about your experience, but also you didn't have a simple case. It was a really difficult case. So with that preface, tell us about your experience.
So the day of the surgery, you even said it was a game time decision, right? How we were going to get it out.
That's right.
It was such a significant size. And there was endometriosis that I didn't even know about, right? There was other issues, underlying issues that we weren't even aware of, which I have to commend you, because I have to say, Dr. Rich is the best. When I even asked him, how many hours is this going to be? He's going to be as long as it takes. And I think that speaks in volumes, because you were like, I know what I'm going in for, but there might be other things that, you know, we weren't even aware of, which we weren't. And you still took the time to clean everything out, I guess, for lack of a better term, and make it look beautiful, you know, in the photos. And now I feel better and I feel at ease. Like, I kept telling my mom, and she makes fun of me of this. The first time I woke up right after surgery, she said, you literally screamed like, I feel like all the blood and all the oxygen that I wasn't getting before, I can get again. And then you knocked back out.
Yeah.
And I was laughing at that, because my mom's like, it's crazy how much relief you had immediately. And I didn't even know I could feel this way, because I've lived with the pain
For so long.
That I just thought, I honestly thought that lower back pain was my knee surgery. Like, oh, it's my knee, I'm overcompensating on this side, so that's why this hurts. And that's why I have this weird feeling here. No, as soon as, like, that was the fibroids, and that was all that, you know, causing all that
the pressure,
discomfort and pain. And so immediately I felt relief, like the minute I woke up. The first day I thought I was going to be in pain. I think my knee surgery was more painful than this, which I was shocked, because this is it's a big surgery, and it's the biggest surgery I think I've had in my life.
Yeah.
And I expected mentally to feel this like excruciating pain. You know, I've had knee surgery, I've had gastric sleeve, I've had so many things done, but the pain was not even it was almost like non-existent in compared to the other ones, which is shocking to me.
Yeah.
And it speaks volumes of how amazing of a doctor you are. And
I got lucky.
yeah. And like even the pain after, you know, I told you I don't like taking the Tylenol coating because I makes me nauseous.
Yeah.
So I took it the first day, but after that I really didn't need it.
For one day you
Yeah.
took. Wow. Okay.
And I was fine with that. Mind you, I'm an anomaly and I have a high threshold for pain.
Yeah, and I think that's worth mentioning. And I think it is a very powerful and valuable message for patients who have the concept that it's going to be something dangerous and high risk and they're going to be out of work for months, that it doesn't have to be.
No.
And I mentioned the experience of the surgeon, I mentioned the robotic platform, I mentioned the pain protocols. And the other factor that you just mentioned is your own constitution, right? The single best determinant of how a patient's going to recover from surgery is how they recover from the last surgery.
Yes.
And there is a spectrum. Everything in life is a bell curve, right? So 80% of people fall into that, 2-3 week recovery range. Then there's outliers for minimally invasive robotic surgery. So there are people like you who are way over here in that 10% that, what do you say, a day after you took pain pills for one day and then you were better? And again, not for a tiny little standard hysterectomy, for a extremely enlarged, highly complicated surgery that also involved removal of endometriosis, right? And then on the other end of the bell curve, there are people who can take 2 to 3 months to recover. And that's just, everybody has their own pain journey, their own experience.
Absolutely.
And just as those people should never be shamed or meant to feel bad that it's taking longer, we also don't want to, look at somebody and say, oh, you're making that up, if they had a very rapid recovery
Correct.
from their experience. And we just have to understand, people are people. They're
Yeah.
going to recover how you're going to recover. And you can't really change your body's experience with pain, but there are those other modifiable factors.
Absolutely. And even in comparison to my knee surgery, I just took 2 weeks off of work because I was like, I've been through it. I knew how I was going to maneuver it.
Yeah.
This was
Yeah.
the first time that I was like, I've never been through anything like this. I don't know what my restrictions are going to be,
Yeah.
or how I'm going to maneuver around it. So I took the recommended time that you told me of
Yeah.
the 8 weeks.
Yep.
And even though I feel great, I'm still cautious.
Yeah.
Because I'm also aware of how significant and how big the surgery was.
Right.
That like, even when you feel like I feel great, I still listen to you where you're like, don't bend, don't pick
Don't
more
overdo
than this
it.
up, don't pick more than 25 pounds up. Like,
Yep.
I think sometimes we get overconfident and we're like, oh, we're good.
Yeah.
And then we're back in your office and like something
Well,
popped or something.
I think we need to emphasize that because I even though there's not much to show for it with robotic surgery, just little incisions, it's still major surgery. So people do have a tendency to feel a little bit overconfident with their recovery process. And then, oh, I'm going to train for a marathon a week after
Yeah.
surgery.
Yeah.
Don't do that. So give your body time to rest. I think it's also worth mentioning that just the standard recovery for Family Medical Leave Act and everything else for hysterectomy is 8 weeks. Now, I joke, tongue in cheek, I say with my patients, just because I do better surgery, I'm not going to take your time away from you, right? So just because we didn't do an open incision, and just because on average in my office for my patients, in my specific setting only, we typically see about a 2-week recovery for people to be back to 90%, doesn't mean that you can't or wouldn't or shouldn't take 2 months.
Correct.
Or 3 months.
Correct.
But if you feel like it and you want to get out, back out there, it gives you that option. The minimally invasive surgery gives you that option.
Yeah. And I think that open, honest communication with your patients is what I appreciate. And your availability to your patients is what I really appreciate. Because I think sometimes we think we're okay and then something happens and we're like, oh my God, what do I do? Do I go to the hospital? Can I call him? Should I bother him? You know what I mean?
Yeah.
And that's the one thing I appreciate about you in your office. Like, I call you guys immediately like see me, and you're like, okay, well, are you eating enough protein for the
Yeah.
healing?
Yeah.
Are you in a this? Are you doing that? Are you like, because sometimes I might need, maybe I'm not healing as quick as I thought.
Yeah.
Or you know what I mean? Because I'm not eating as much as I am. Like, I think
Yeah.
I had a conversation with Castro yesterday, and she's like, are you eating enough protein? And I was
Yeah.
like, well, I'm eating twice a day. She's like, you need to eat 4 times a day, and you need at least 40 grams of protein in each meal.
Yeah.
Like, you don't think about that when you're healing from a surgery. Do you know what I mean? You're just like, oh, okay. Because like in my mind, I'm thinking I can go back to my normal
Yeah.
routine.
Yeah.
And you really can't. You still have to be very conscious of like the decisions that you're making, even just simple as like how much protein am I eating, so everything can
Yeah.
stitch back up properly.
Well, Michael Phelps consumed 6,000 calories the day before competition because his body needed that reserve to perform at a world elite level. And our bodies, when we undergo surgery, it's a trauma. Literally and figuratively, things are taken out of our body. And we have to heal, and we need those substrates that you can only basically get by, well, I guess you get IV, but you get it by your intake. There's a higher caloric demand, there's a higher demand for, well, fats, carbs, and proteins. But we have to be able to recover, and we can't do that if we're doing too much, if we're burning the candle at both ends still. And so, on the one hand, I think it's great that we're in an amazing era in human history, right? Where we can get robots to do our surgery more precisely and allow patients to go home the same day. But at the same time, we're all human, and we do need to take a little pause and really let our bodies heal.
Absolutely. Especially from a hysterectomy, which is the scariest word that a woman, I think, can hear.
Well, tell me about that. I before we started filming, we were having a conversation about how it's, surprisingly in 2025, somehow it's still taboo.
Yeah, 100%. Like, I remember when I finally made the decision, like, okay, this is what we're doing. I wanted to get the point of view of a woman who's in my age group, right? Because I know people who are
21.
60 and above. 21.
Oh, yeah, okay.
Yeah.
No, but how,
I'm 41,
for the audience, yeah.
41, and
Okay.
I'm proud of it. Estee Lauder. And all A&R.
That's it.
But yeah, so shameless plug. But anyways.
Oh, plug away.
But yeah, I think it's the scariest to hear, even if you're at peace with the fact that, like, okay, children are not in my future. Does this mean I'm going to go into early menopause? Does this mean that I'm going to, like, be at risk for osteoporosis? Does this mean, like, everything that you go into, like, the internet and start reading on your own, which is the first rule you tell us not to do.
Dr. Google.
We start to do that. And it's just scary. It's scary. And I remember I asked a bunch of friends, like, do you know anyone who's had a hysterectomy that's in my age group? Because I would love to get their point of view of, like, after it's done, like, how have you been? How do you feel? And I remember one of my coworkers said, do you mind if I share with a friend of mine? And then I'll see if she can contact you.
But let me talk to them before I
tell you.
Okay.
Which I understand, because you don't want to share somebody else's, So I said, sure. Turned out being another coworker.
Okay.
So it was like this whole underground tunnel.
So someone you already worked with,
like,
you didn't know.
But I didn't know.
Oh, wow.
But it was just funny to me because it's like, it's this like, you don't talk about it. You don't say that word. You don't say hysterectomy.
It's like a
menopause.
speakeasy.
You
gotta have a password.
Yes.
Wow.
And I think I told you I went to an Ulta conference and I met an influencer who shared her story with me because she overheard me telling somebody about it. And like, so we just ended up, so it was really nice to hear somebody's point of view after the fact, which made it less scary.
Less scary, yeah.
Because nobody talks about it. Nobody talks about, like, as something as simple as, like, is my vagina going to be different?
Right.
Is sex going to be different? Is, am I gonna lose hormones faster? Am I going to jump into menopause? Like, those were all the same questions I asked you. And you put my fears to rest. But it was also good to hear it from somebody else who lived it.
Who lived it. And that's, honestly, that's why you're here. Because, I've done 4,500 robotic surgeries. I could do 4,500 more, but guess what? I'll never have a hysterectomy.
Yeah.
Right? And so, you are the voice that women out there that are struggling with this decision can turn to. And I think that's very powerful. And you brought up a couple good things I'm just going to touch on briefly. the conversations that we had. So does does it have to mean that you take your ovaries with the uterus? And of course we said, absolutely not.
And that's a misconception, though.
It's a big
A
misconception.
lot of women, I thought I was having a partial hysterectomy because I was keeping my ovaries. And they're like, no, girlfriend, it's a full hysterectomy. And I was like, but you're keeping my ovaries. So
Yeah.
that was, and I even spoke to a friend yesterday who's in her 60s. And she said the same thing. She's like, well, doesn't partial mean you keep your ovaries? I'm like, that's what I thought too.
Yeah.
It's our own, we don't even know.
And the challenge is that the layman's terms are not based on any medical background. So when we talk about total versus partial, it honestly means 5 different things to 3 different people.
Oh, wow.
And in the medical terms, to make sure that everybody can utilize the same terminology that means the same thing every single time, when we say total hysterectomy, or in this case, total robotic hysterectomy, what that means is the uterus and the cervix are being removed.
Mm-hmm.
And that's the totality of the uterus, so it's called total hysterectomy. Now, the tubes and the ovaries are their own organs, and so they have their own words that will identify whether or not they're being removed. So if you take the tubes, it's total hysterectomy with salpingectomy. If you take the ovaries and the tubes, total hysterectomy with bilateral salpingo-oophorectomy. So no one in layman's terms is ever going to know that or say that. So we just defer to partial or total, but nobody knows what it means. So that's kind of the challenge. That's how doctors and medical professionals keep it straight.
Yeah.
But when you talk to your doctor and you say I had a total, you're gonna have to qualify what that means. And a lot of patients, they don't even know.
Yeah.
But going back to the preservation of the ovaries, so we can have a total hysterectomy and you can keep your ovaries. So the ovaries are an endocrine organ, okay? They produce hormones, like your thyroid, like your adrenal glands. What separates them is they have an expiration date.
Yep.
So once they stop producing eggs, once you stop ovulating, everybody's familiar with the idea of menopause, the menopausal transition, the change of life. That's because the ovary has run out of eggs. And when they run out of eggs, then they no longer respond to the hormones produced in the brain, in the pituitary gland, that stimulate the egg maturation process, which causes the ovary to make estrogen, and ovulation, which causes the ovary to make progesterone. So those hormones are essentially undetectable, remote from the actual last menstrual period or the change of life, the natural menopause. We have to understand that the uterus itself does not make any hormones. And that's kind of where the confusion comes. So people say, well, if you get hysterectomy, am I going to go through menopause? Well, the uterus doesn't make any hormones, so you're not going to actually have any change in production from that organ by removing it because it never made hormones. The caveat, the kicker, is you cannot remove the uterus without cutting the literal bloodline, the vascular attachment between the uterus. I'm going to take our little guy here. You cannot remove this without severing the connection between the ovary and the uterus. When you sever this connection, you decrease the total amount of blood flow to the ovary. Now, there's a second pedicle that comes off here, and that's the main supply of blood for the ovary. So it still exists, it still gets blood flow, it still produces hormones. Best available evidence shows that you will go through menopause 2 to 4 years earlier if we remove this one and if you keep the ovaries. So, and I mean, you brought it up, and I think a lot of people get really confused about it, and it's worth taking a couple minutes to talk about that so people can make a better, more informed decision.
Now, another funny thing I noticed is that you guys warned me about this. I was still had PMS symptoms.
Yeah.
And I'm currently having them right now.
Don't do anything.
Which is really funny because I didn't expect it. And when I was speaking to your nurse practitioner yesterday, I was like, I have a lot of tenderness.
Yep.
And she's like, oh, was this
breast
the week we were
tenderness
supposed to get it? And I was like, I looked at my calendar. I was like, yeah.
Uh-huh.
And we were just, I was like, I didn't expect it to, I was still having the cravings too.
Yeah.
Which is crazy to me.
Yeah.
But it's funny because it lets me know my ovaries are still good. They're still working.
Well, and exactly. That's evidence of the fact that your ovaries are still good. They're still making hormones. And, one day, I tell every patient, menopause is inevitable. Everybody will go through menopause. And if you have a hysterectomy, it's going to be a little bit sooner, but not immediate as a result, so long as you keep your ovaries.
Absolutely. And I think it's important to mention that for my situation, the reason I chose the hysterectomy was that was the only option for the size of the fibroids that I had. Because I had 10, correct, and one significantly larger one. That was like the size of what, like a grapefruit or something? Like
It was softball, grapefruit, cantaloupe, somewhere in that range.
Yeah. So that's, I think that's another thing that women, there's so many women that have fibroids that we don't deal with it, or we don't choose to like treat it.
Yeah.
Because we're like, well, we can live with it, right?
Yes.
That was my question to you the first time, remember? Where
Yes.
I was like, is this going to be detrimental? Like, do I need to get rid of it? What happens if I don't? Obviously, the size of mine, it was starting to block other organs.
Well, and you mentioned I think you said leg pain.
Lower back.
Or lower back, that resolved, and these are things that we don't even cognitively assign that this is responsible for that. And then, you're like, and I don't know what your sentiment is, but most patients after the surgery, they're like, why did I wait so long?
100%. And that's what every woman that did have this told me the same thing. They're like, I always wondered why I waited so long. And I remember even with ours, so when I was discussing it with you, I was like, well, I don't know how fast they're growing. And we didn't have a previous note either, because nobody knew that I even had them, or nobody was even aware until it did get significantly large, to the point where it was spelled in an exam, like a regular pap smear exam. But I think it's important to give women the knowledge and the permission to be able to do this and to treat it. It's not something you should wait on.
Yeah.
Because it could eventually become you never want to be to the point where you're like, you need to have an emergency hysterectomy.
That's right. Yeah.
You know what I mean? And mine was pretty bad.
And you brought up, I think, an important point about fibroids. And I just don't want the audience to understand, and I don't think that they did based on the way that we conversed about your options. But there were a lot of fibroids, and there were a lot of big fibroids. And we talked about the option of plucking out the fibroids. We also talked about the option of burning the fibroids with a probe. And our job is to give information, right? You take the information and you're like, on the one hand, I could have, a surgery that, given the size that my uterus currently is, no matter how many we get out, the likelihood that they're going to grow back in the next decade, more likely than not. And it won't be my last surgery. And you take that information and you say, versus doing one thing, one time, totally different conversation for someone who their important goal in life is childbearing, right? So if that's not part of the equation, then all of these things are options. So I just, want to make sure the audience understands that, as you mentioned, you went to see a doctor, your first doctor said, this is your only choice. Yeah. So if you're only given one choice, I mean, you tell me, but I would suggest you find somebody else, right?
And I think in one of your other videos you mentioned, because I did go down before I came to you, of all the
you researched. Oh my gosh.
And you mentioned the same thing. If your doctor gives you one option, please go see at least 3 other doctors, right? And you were my third, lucky number 3, right?
Third time's a charm.
Third time's a charm. But what I loved about you is that you took the time to really explain each option and why it wasn't suitable, or it was. And you said, listen, if you want to do this, cool, but let me explain to you why it might not be the best. Like, it's not going to decrease it. If we do this, it's going to still be a problem, and it was something that I really had to sit with myself. And it was a year that I came to see you before we made the decision.
And talk about that, because I do think that it can't be understated that ultimately the decision has to be your decision. And I try to end every conversation, every counseling conversation with, you understand the options, I'll do whatever you want to do. I can tell you what I think is best. It's your body, I'll do whatever you want to do. And lastly, take as much time until you are 100%. If you sit here right now and you're 99.9%, don't do surgery.
Right.
Come back when you're 100%.
Right. And I remember that, and that stuck with me, because the first time I met you, I was iffy about it, and I was like, all right, let me take all this information, because it's overwhelming,
Yeah.
right? Especially hearing that hysterectomy is your best option. It's still a scary.
Yeah, it takes time. It takes time to process. The first time you hear it, it's shocking.
Yeah. I think I cried. And I called my boss and I cried to her on the phone, because I was like, I have to make peace with the idea that there isn't going to be the option of children anymore, or at least not in the natural sense, right?
Right.
Then I had set up an appointment with you for 6 months later to keep an eye on them, because you're like, okay, well then let's just keep an eye on them and let's start to get a record of how fast they're growing and when they're growing and whatnot. And then at the 6-month mark, I was like, all right, let's, like, so if we're doing this, like, when would we do this? And like, do you think I still can do this? Am I still a candidate for laparoscopic? Because there was going to be a point where I wasn't going to be a candidate.
There comes a point where nobody can do it,
Correct. And I remember before we decided to go, well, when we did decide to go in the surgery, that you were like, there's an 80% chance I can still do this.
Yeah.
Because it was growing.
Yep.
And it was getting to a point where I would have to be cut completely if I wanted to do it.
Eventually, that becomes an option for everybody if it goes too big.
That's what I wanted to avoid, right? Selfishly, because I wanted you to do the surgery as well. But also because the less cutting, the better.
The better, yeah.
You know? Less risk of, like you were saying, like the hernias and all those things, right? And I think it's important for what I can appreciate with you is you always took the time to meet with me and counsel me through the decision, even if it was like you're repeating the same thing over and over again. You were like, if you're not 100% sure, like, tell me when you're 100% sure. And that last time, I was like, all right, fine, let's do it. Can we do next Friday? We made a joke. We're like, can we do next Friday at 7? Like, are you good? Are you free?
Can we make an appointment right now?
Can we fit it in? And I mean, obviously, it wasn't that fast, but it was pretty fast that we did book it. We got lucky. But I think it was comforting. Even walking into the surgery, I think I was still scared until I saw you. And then it put me a little bit at ease. You know what I mean? But I was crying the entire time. Until, like, you saw me and you just smiled and you're like, are you ready? And I'm like, as ready as I'm going to be.
As you're ever going to be. Yep. And the truth is, no one's ever ready, right?
No, but I think it's important to have that relationship with your doctor so that you feel at ease with the decision.
I mean, trust is the key. And if you, I'd like to say that every relationship I've ever had has been a solid, bi-directional trust. The truth is, people are people, and I feel that most of my patients are very comfortable. I try to do everything I can to be a good surgeon, but to be a good person.
Right.
And I don't always succeed. And if I'm not the right person for you, somebody is. But you have to have the comfort. You have to have the rapport, and you just have to feel like there's a trust that you're in good hands, that we're going to be able to handle whatever comes up.
Yeah, and mind you, we're different because I did see you for a year before I came to the decision, right? So you were like, girl.
And not everybody. That's...
No, and most people don't.
Hurry up already. Yeah.
Like, are we doing this?
Yeah.
But no, I think that's a different thing. But I think it was the best decision I ever made. I don't know why I didn't make it sooner. Because the relief I feel even now. And now I'm 4 weeks out exactly today.
Yeah. Yeah. You look amazing. Every time I've seen you and talked to you, you've sounded like, it almost seems like you didn't even have surgery. You're doing amazing.
Thank you. I have to remind myself to still not bend or do anything, right? But yeah, it hasn't been painful. Like I did get a little cramping at first, and all the normal things that happen after surgery, but nothing to the point where I was in severe pain or anything. Like I said, I only took the painkillers one day. It's probably the easiest recovery I've had compared to all my surgeries that I've had.
And I think that, again, we understand you're an outlier, but we also understand that it's possible. It's possible to have that outcome, and it's possible to have an outcome on the other end of the spectrum. So if you could give one piece of advice to someone in your shoes who is struggling with a decision about a hysterectomy, what would that be?
I'd say definitely have an open conversation with your doctor and your family. because I think you need to have that, especially after recovery. You still need to have those behind you to make sure that you're not doing the things you're not supposed to be doing. But definitely, so that if you have any questions on the procedure or what's going to happen or how it's going to happen, I think you need to have that open dialogue with your doctor, which I had with you. That it's important because it helps put your fears at rest. It definitely helps like soften the blow a little bit and make you less nervous. But you're still going to be nervous, and it's okay.
Yeah.
And it's okay to still cry because it's a big, big surgery, and it's not just a surgery; it's also a new chapter of your life.
Yeah.
That you have to let go, and an old chapter you have to let go of.
Yeah.
You know, whether it is to continue to have children or not have children. It's even if you were thinking of not having children, the option being taken away is
right. It's totally different.
It's a whole nother emotional feel, you know.
And I think, I mean, correct me if I'm wrong, but that is part of the reason why it's so important to come to that decision in your own time, not to have it pushed on you by your family or your doctor or something like that.
Absolutely. And the previous doctors were like, "Oh, you got to do this, and that's it. You got to do it right now."
Yeah.
You know, and I felt really rushed into the decision.
Yeah.
So I think it's important to find the right doctor for yourself and the right option of how to do it. If laparoscopic is an option for you, I recommend laparoscopic 100%. But I also recommend to make sure you do it with somebody that you feel comfortable with doing.
We had talked about permanent loss of fertility a couple times now, and I just, again, for the audience, I want everybody to know that it is an irreversible procedure. There have been a small handful of uterus transplants done in the history of the world, but that's not a practical option. What is a practical option, though, is egg freezing. So you could have your own genetic material with a surrogate, or using a surrogate, adoption. There are so many children that need a family. So there are a lot of other options for someone if whatever reason, it could be fibroids, it could be cancer, it could be any number of things, puts them in a situation. And if that gives anybody any comfort to make the decision, but again, it is a difficult decision, even in your mind, if you've decided, you know what, I'm okay. I'm okay with not childbearing. Not that I would ever know, but I've been through this so many times with so many patients, and I've seen their journey, and it's never an easy one, and that's why it has to be your decision.
And you brought up a really valid point right now when you said if it's cancer. I think that makes the decision easier because you're like, I have to remove it.
That's it, yeah.
When it's fibroids, it's not cancers or not cancer, it's tumors. But you're like, well, I can live with it. How long can I live with it? And you choose to live in this pain because you don't want to, whether it's because you don't want to take the time off, or whatever it is, right? Or your fear of the hysterectomy itself, that you're like, I can live with this pain. I think that's probably, I'm going to change my answer. The advice is if you have fibroids, and you should get them treated and do the hysterectomy. Because if I would have known I was going to feel this relief,
on the other side,
I would have done it a lot sooner than I did before. Like I suffered. I had the heavy periods. I had the lower back pain. I had such bad pain that I thought it was, again, from my knee surgery, like me overcompensating, and I had no idea it was this. I had this weird, uncomfortable side feeling.
Side pain,
And it was the fibroids.
It was all the fibroids.
Causing all that. And probably the endometriosis as well wasn't helping. But I think it's really important that you make the right decision of treatment, especially when it's fibroids. Because, like, again, when it's cancer, you're like, well, we have to get it out. You have to take it out.
Done.
It's like, let's schedule it. But when it's something that's not life-threatening, even though eventually it can be, like mine were, where it's blocking other organs, I think it's important to give women the permission that, like, you should get the treatment you should get, because you don't have to live with it. You know, and I think as most women, me and myself, I always think like, well, I can still deal with it. It's not too bad. Like I can.
I can live with it.
I can live with it.
I can live. I mean, think about that. I can live with it. There's a lot of things we can live with, we can suffer through, and none of that is to diminish the and I'm glad we're talking about this, because there's nothing that you can't get something for nothing in life. I mean, anything worth having, there's going to be some struggle and sacrifice. And in no way to diminish what we just talked about, the emotional and spiritual and the journey that a woman has to go through when it's a final decision and the uterus is out. But is it worth all the suffering? And that is a question, and it's an anxiety that so many people struggle with. And your answer is the absolute right thing for you. Mm-hmm. It may not be right for somebody else, and everybody's got to come to that in their whole time. But I'm so glad that you could come on today and we can just explore the range of surgical options, emotional experience, and everything that a patient has to go through. I'm so grateful that you are willing to come and just like the influencer that you met, right? That there are champions like yourself that are willing to share their very personal experience for the benefit of so many women that are feeling, they're struggling and feeling alone, and feeling like they don't have information, they can't make a right decision, or they don't have enough to make a right decision, or the family support, or the support of their healthcare system.
Absolutely.
What else would you want anybody to know about your experience?
I think it's my thing with my experience. I wanted to know the point of view of somebody who was my age going through it.
Yes.
I think we all know somebody in, their ageless years, that has gone through it.
Yes.
But they're already menopausal, or they're already,
fertility ship had sailed.
Fertility ship had already sailed. So it was an easier decision for them.
Yeah.
I think it's a little scarier when it's somebody in maybe the 40s and 50s. And I'm still in the beginning stages, obviously, but I feel phenomenal, right?
That's amazing.
And I was lucky enough to have a couple of friends, like we mentioned, that I met in this process that have undergone it and told me they feel great. Like sex wasn't different, and that hormones were still the same, and they felt great. And I think that's important to share, that it's not going to be the end of something.
Yeah.
Like you're not going to all of a sudden, put me out to pasture kind of thing. Like, I think that's what we picture in our head, that like, that's it, our life is over, and I think it's societal, right?
Yep.
Like, if you can't produce children, then
somehow you have less value.
Correct.
Yes.
And that was something that I had to make peace with.
Yes.
I had to, even knowing myself, knowing that those two do not correlate, I still had to tell myself it's okay.
Yeah.
And that my value doesn't change because I cannot produce a child naturally.
That is, I think, so important for everybody here.
And I think that's the one thing I want women to take away with. Because me being a single woman at 41, never married, no kids, still single.
Light up the comment section.
But I think, there's almost like a stigma, like there's something wrong with me, right? And then to take away and add the hysterectomy, it's like, great, another scarlet letter I have to bear, right?
Another.
And I think it's important for women to be like, it's okay to not have children naturally. Yeah. Now, if I have children another way, great. But it's okay for me to make this decision for myself, for my health, and to live a pain-free existence. Yeah. And essentially to protect my other organs. Yeah. Because that was going to eventually be a problem, Yeah. But I think that's the best thing. And to another misconception, not everything else is going to fall out, Dr. Rich, because that was another thing. Like, I even asked you, is everything else going to fall out?
And that's a great question, and we've done videos on this, and we'll touch on it now, is that a third of women will have prolapse. It's common, it's epidemic. Unfortunately, another taboo that women won't talk about, prolapse and urinary incontinence. Hysterectomy is a risk factor for the future development of prolapse, which we have to understand that the main risk factors are obstetrical, large babies, instrumented deliveries, long labors. So someone may have fewer risk factors and never get prolapse. Generally speaking, not always, but generally speaking, surgeons, especially pelvic reconstructive urogynecology surgeons, will provide support. They'll actually stitch the top of the vagina where the cervix and uterus were into ligaments to provide that support, thereby actually lowering overall the lifetime risk of 33% for pelvic organ prolapse. So I think that's, I mean, we didn't even bring that up, but I think that's important for everybody to know. And education. I mean, I think that's the big thing. So the support of your family, make sure you speak with your doctor. If you're not liking what you hear, get another opinion, 2, 3 more opinions. And the most important thing, like and subscribe to the Dr. Rich channel.